I was in an elevator taking a lady who was about to deliver her 8th baby up 2 floors to the delivery suite, and I was a medical student and had been caring for this lady pre her being ready to deliver. So the obstetrician had to stay behind and check another woman, and I said, okay, I'll take the lady upstairs, and I wheeled her on this elevator, and we went up a floor and halfway to the next floor where the delivery rooms were, and the elevator stopped and all the lights went out cold. And she says to me, Dr. Deckers, I'm going to deliver my baby. I said, ma'am, could I suggest you wait a while? I've never delivered a baby. She said, don't worry, I've delivered 7. And so the baby was delivered, primarily with me just catching the baby. And she says, doctor, you got to tie off the umbilical cord. I used my shoelace to tie off the umbilical cord. And the baby was fine, and the mother was fine, and she was laughing. And we were on this elevator for the better part of 2 hours.
This confused, sweaty young medical student would go on to be a surgical oncologist, executive vice president of a health center, and dean of a medical school. Today on our podcast, we explore life, surgery, and balance. Let's meet the man behind the story.
My name is Peter Deckers, and currently I am the Dean Emeritus of the University of Connecticut School of Medicine. I work 2 days a week. Wednesday I see patients all day. I do a little surgery on Thursday mornings, and I teach PCM 2.
PCM 2 standing for Principles of Clinical Medicine 2, a class for second-year medical students refining histories, physicals, and all other things you need to sound serious in that white coat.
On Thursday afternoons, beginning in September and running through mid-May. But most of the time I run around doing the honey-do list for my wife.
Okay, that's cute, but let's start with the medical part of his career.
The point here is that he's a surgical oncologist.
Sounds like a gunner.
Touche. For those of you who don't know, surgical oncology is a subspecialty of general surgery, dealing with cancers of the human body and the surgeries that treat them. Nowadays, it's divided into anatomic subspecialties. Think head cancer surgery, breast cancer surgery, etc. The patient load is high, and the hours are long.
So why would someone want to go into that?
Well, you're saving lives minute to minute, you're treating cancer, and given current population trends, there's projected to be a shortage in the next several years.
So how would I get there?
5 years general surgery, fellowship for 2.
And how did Dr. Deckers get there?
So it all started when his dad pushed him to become a medical assistant at the age of 15.
So I went to work at this hospital, and work meant 7 o'clock in the morning till 4 o'clock in the afternoon at $1.25 an hour. And I worked with nurses on a men's surgical floor, and my job was to take care of the men. I learned lots of things, including putting NG tubes in the stomach and urinary catheters in the bladder to drain urine, start IVs. I was taking people to the operating room. I was watching operations. When people died, I was preparing their body for the morgue and taking them to the morgue and watching autopsies.
Jeez, watching autopsies in high school?
Well, hey, Sonny, we've dissected an entire cadaver.
Yeah, but it's different here. I mean, he sees the patient before surgery. He sees them in surgery. In fact, he even sees them not make it. He sees them die on the table. And then a couple hours later, he's there to see the autopsy. It's just a different level of connection than anatomy.
I see where you're getting at.
I think what I'm trying to say is that he and I just have different emotional toolboxes, and I think, frankly, that's what brought him to where he is today.
Did it bother me when people died? Yes, absolutely. Mostly it bothered me when people died who were young and it was unexpected.
So now I'm starting to see kind of pieces fitting together for a great surgeon. He's got that early exposure to surgery. He eventually goes to the College of Holy Cross and then Boston University School of Medicine. But how does he go there to, well, everything else? Being a dean, being the vice president.
Well, Jay, it all started with the Vietnam War.
I just happened to be reading a journal one night, and I saw a little ad for clinical associates at the National Cancer Institute. And it said you would be an officer in the United States Public Health Service, and it was an alternate to the Berry plan of going to Vietnam. And as I said, I was crazy enough at that particular time that if I had not been married and had 2.5 children, I would have loved to have gone to Vietnam, but as a physician. But that wasn't the case. I applied for that job, and I needed 4 recommendations. I went to the chief of medicine at BU, the chief of surgery at BU, the chief of surgical oncology. They wrote me letters of recommendation. I was invited for an interview and accepted for some reason. And I remember distinctly going down there in end of June 1968 with the kids in the car and my wife. And I said, I have no idea why I'm going down here. I have no idea at all about what research is. None.